meeting to order.
Ready?
Call the Health Committee meeting to order, June 6, 2017, 9:30 a.m. All members are present except for Mr. Kokonoff and McTaggart. Two farmers. Are there any public comments to come before the committee? Hearing none, we'll go to agency reports. There's none attending, so now we go to Mr. Cece and the ICPHD report.
Morning, folks.
Morning.
Good morning, Eric.
Please take one and pass it around, and then sign up this guy. The first packet coming out to you is the normal report that you get. I can try to answer any questions, but ultimately, that's not my game. So, and then the second thing is a summary of bullet points of things I'm going to talk about today about emergency preparedness.
Well, on this sheet, we basically just follow the trend.
Sure.
Upward or downward. So the only thing that stands out in my mind are wells. It went up.
Yes. Well, I can't. I don't work in wells, but you know, try and drill and see them. Ground thawed. Immunizations are way up, especially among childhood. Especially when you compare those numbers to 2016.
Couple communicable diseases that have popped up that we haven't had before. E. coli, salmonella, Ichthyosis. Any other comments on the summary report?
Anybody know what varicella is? I sure don't.
I knew at one point in time, Mr. Persley.
It's Dan.
Dan Persley. But I don't know off the top of my head, I'm sorry.
Anybody else know what that is?
I'll look it up when I get home. I'm gonna look it up when I get out of here.
Okay. I sure don't know
I'm in that too, Dan.
No other questions on the summary report? Anyone brief us on emergency preparedness?
So, as you probably know, my role at the Iroquois County Public Health Department is the Emergency Preparedness Coordinator. So, what does that mean? Well, it means I prepare for emergencies. But a better definition, I just came up with this, is ensuring readiness for disasters, both large and small, that could negatively affect the overall health of the community by collaborating with in-house programs, local agencies, and regional accounting partners. Now, to delve in further to that definition, what I mean by large and small. My role is to prepare for large emergencies or disasters, say a devastating pandemic in the county or in the nation, or a bioterrorist attack, or small outbreak in a nursing home, or in a daycare, or power outages at a nursing home. That's something we like to look at when it comes to susceptible populations. What I mean by in-house programs, it's my job to do my best to collaborate between environmental health, Department of Aging, and community health, and administration. These are all different programs within the health department, and I do my best to maintain a working knowledge of those areas. So, because they're often in the field and they might be involved with stuff, as we see, the different types of illnesses that are reported every month. I try to look at that to sense patterns of what could be happening, what is not a threat, what is a threat, and also with environmental. We get concerned about wells sometimes. During the last floods back in 2015, something the health department did was provide free well samples to private wells to try to help people that might have got their wells contaminated from floods. Local agencies try to work with nursing homes and the hospital and other healthcare type entities, in addition to other entities as well besides healthcare. Regional, not only do I work with my counterparts in other counties, but also with, there's a Champaign Region Healthcare Coalition that we belong to. And I'm actually representative on that, representing local health department. So I work with them a lot. The emergency preparedness at public health department here is funded by the FEP grant, which is a grant from the CDC, the Center for Domestic Preparedness and Response. And it is passed through Illinois Department of Public Health, which takes some, but they are kind enough to provide it to local health departments. Not every state does that. You can see the numbers for the current fiscal year, which, just as a note, is from July 1st through June 30th. The numbers for this current fiscal year are significantly higher than the coming year for a reason. Over this past year, we've managed to capitalize on a couple opportunities for extra grant money. With the FEP grant, we wrote proposals for particular projects such as distributing biohazard spill kits. And we were able to get an additional, I think, $6,000 for that this year. And that's a large part of why this year's current grant, FED grant money is a lot higher than what you see. So, there's that. Projects that I continually work on for emergency preparedness with the health department. We have a health department emergency operations plan, which also includes our strategic national stockpile plan. It's really what it's based around. Strategic National Stockpile, or SNS, is a national program to basically, in the event of a medical disaster, say a large outbreak or a bioterrorist attack, to mass medicate, vaccinate, whatever, everybody in the county within 72 hours. 72-hour time frame comes from this anthrax scenario, and that's how long you have after exposure to get the people antibiotics. So we have a plan specifically for that project. We have specific sites that we like to keep semi-secret, and we have our materials and we have our procedures, blah, blah, blah.
You can practice.
Yes, I'll get into that. Thank you. So that's what that is centered around. And later on I'll talk about how I'm broadening the emergency operations plan for the health department to incorporate more hazards. But I need to update that plan once a year. Exercise. We have to have an annual exercise according to the FEP, and it needs to follow a particular HC for Homeland Security and Exercise and Evaluation Program guidance, which means more work on my part, more paperwork, more staples, and more repetitive jargon. But it keeps us aligned in order to make sure that we're striving towards goals and that we fix what we find is wrong. So it's a decent system, it's just paperwork. What that also involves is writing after-action reports after every exercise and improvement plans. These reports and improvement plans we use as guidance when we plan the next year's exercises. So And on that note, we're actually having a small drill tomorrow to practice an anthrax scenario. It's just going to be us health department people. We're working on a very particular part of the mission, not a broad one. Last year in June, we did a very large full-scale exercise out at the fairgrounds. We had volunteers drive through, and we practiced the whole shebang. We practiced receiving medical supplies from the state, and the next day we practiced dispensing those as quickly as we can in the drive-through scenario. It's almost like McDonald's, only instead of a Big Mac, you're getting antibiotics. So, besides just the exercises we have, we also have a number of small drills that we have to conduct, lots of them quarterly. Notification drills. I use a software system provided by the state called Siren, State of Illinois Rapid Electronic Notification System. And what this allows me to do is send out a robotic message to everybody on an Excel list that I have. So I'll do that probably once a quarter with public health department staff, and they respond by pressing 1, 2, or 3, and get some metrics out of that. Starcom 21 Radio. Starcom 21 Radio is a statewide radio network. Usually with a radio, you can't talk to somebody down in Springfield unless you have a really, really great amateur radio. These is a digital radio network built by the state. So if I was in Chicago, I could talk to somebody in Carbondale. State of Illinois wide. And so I do a monthly drill for that with the health department, other health departments. There's public health mutual aid requests, or IFMAS. Forewarning, I use a lot of acronyms. So if I say an acronym and I haven't explained it yet, stop me. That is a system health departments use as a mutual aid request. Each health department has to send out a IFMAS request drill once a year, and it could be any time during the year. So once a year I send out a drill saying I need 5 nurses and 6 sanitarians and 3 clerical. Other health departments respond within 24 hours, and same with me to them, and that happens throughout the year. We use a volunteer registration and deployment system called Illinois Helps, another online software. While the health department does not have specifically any registered volunteers, we do partner with Vermilion County MRC in order to fill that grant deliverable. And I work with my counterpart down there to coordinate with volunteers and help recruit hopefully in the future. Yes, sir.
Question, how do you coordinate with, say, Kankakee County, Will County, Vermilion County,
Sure.
Champaign County, and some of the other counties? Is there like an open line or something to all these, so everybody knows what's going on? If something happens, or a practice?
Yes. Let's say if something happens, I subscribe to Illinois State Terrorism Intelligence Center notifications. And I also subscribe to that for my other job as well. And it's very beneficial because if there is, say, well, the latest example, with the London attacks that happened, as those reports started coming in, that information was shared with Illinois Emergency Management Agency, and they push it out to us by email so we can see what current threats are. And the same goes with outbreaks. When Ebola was a big buzzword, and when Zika was a big buzzword, I'm getting reports from that state. And so that's one way. Also, the state of Illinois makes sure that all the local health departments use a variety of different online softwares and programs to share information. IMATs, or inventory management, that's something that everybody uses throughout the state to log their strategic national stockpile assets. So that's something that I have to make sure I put in there, and the state sees it, and the state can also see what Kankakee has. So if we have a local event and I need 30,000 doses of ciprofloxacin, we don't have it, but say Kankakee has it, the state will be able to see that and ask Kankakee for it down.
You know, you mentioned a far-fetched, but within reality, what if there's a blackout?
Good question. Starcom 21 radio is one of the backup communication systems we use because you're right. Especially, we've had a number of network problems. What really comes to mind is when the county was down for a day just because somebody stole some fiber cable up on Route 1 north of Papineau. And so we do take that into effect, and we have not only Starcom 21 radio, but a couple other radio avenues to communicate with other counties should we have a situation like that. And also I do a number of local in-house builds with our health department staff for just normal safety stuff, tornadoes, fires, so on and so forth. The fourth bullet point under projects, I work on a handful of things with more acronyms to bring you. I have to conduct an annual training exercise planning workshop, which is where I work with partners, local partners. We sit in a room and we all discuss what trainings and exercises we wish or think we need to have and start planning 5 years out. And I usually conduct that in collaboration with my other half, just because my other half also has to do that. So I do that, as well as a hazard and vulnerability assessment. We do that annually. That's a nice little tool that we use to see what hazards are more probable for us, but also how vulnerable we are to those hazards. So, and then a public health capability assessment. Public health departments for emergency preparedness have 16 core capabilities that we need to work on and build. And annually we have to assess where we are at with those capabilities. Conduct that once a year. And then with all that information in mind, I conduct a MITEC, or multi-year training exercise plan, and where I make a plan, ideally for 5 years, sometimes it's only for 3, of what exercises and trainings, what path we are on for 3 to 5 years. So, another project that I work on is I'm subject to annual visits from IDPH. It's kind of like an audit to make sure that I'm working. And biannually, that visit is a Medical Countermeasure Operational Readiness Review, or MCMORR. That is my least favorite acronym, and it's awful. But anyways, this is a large assessment that I complete before the auditor comes and looks at it. So they come and then they either agree with my self-assessments or they disagree. And they disagree, I need to work. But it's also a way for the state to push us to expanding our horizons beyond the SNS mission. I've already mentioned the Champaign Regional Healthcare Coalition. This is a healthcare coalition that is made up of hospitals, ambulance services, nursing homes, and also fire departments, EMAs, and local health departments. Primary members are hospitals, and then other different types of agencies usually have one representative. I'm the local health department representative for the Champaign region, and moving forward, our grants are actually mandating us to do more work with them, so I'm expecting our workload to pick up with that coalition, which is fine. And I've already mentioned I work with Vermilion County MRC in volunteer recruitment and coordination. Any questions on those projects that I listed before I move on to?
Yeah, I got one more for right now.
Thank you.
Are you the one to take charge of Iroquois County, or do you, who says, if there's a disaster, who says you do this, you do this, you do that, you do that? Is there like a, for lack of a better word, a commander?
When it comes to public health, I am not the one to take charge. The administrator takes charge of public health operations for me. When it comes to emergency management agency, I do coordinate efforts. I don't take charge. It's more of a collaboration of ensuring that everybody has what they need to do their jobs in the event of a large-scale disaster. So, but that's a different discussion about EMA entirely. For public health, no, I do not take charge. But it's a good question. Just before I move on, varicella is chickenpox.
Say that again?
Varicella is chickenpox.
Okay, thank you.
I knew that sounded emphasis of mission. When it comes to public health emergency preparedness, there are three major things that you want to try to do, or your activities need to be contributed to. Bioterrorism and outbreak preparedness. A lot of that comes with the SNS mission, but also with smaller goals, like I talked about in the definition of preparedness. Planning for functional and susceptible populations. This is something that we're seeing more and more in a push from the state. And it's important because functional and susceptible populations, these are the areas that can be, their health can be most affected by their circumstances or emergencies. And this could be anything from nursing homes, daycares, people that only speak foreign languages. These are people that have less access to what they need or are more susceptible. As an example, children are more susceptible to chickenpox. So we need to help prepare for that. And build the FEP capabilities. I mentioned that before. We have 16 FEP capabilities, and the better we are at each of those capabilities, the more prepared we are to respond to a public health emergency. Assets that we have through the public health program. STARCOM 21 radios, we have 4 of those. And because we can communicate without the state, they are a very good asset. Actually, during this last grant fiscal year, we bought an antenna and put it on top of the point of that roof to make sure that we can get STARCOM 21 radio signal to a tower in Ashland. So, good there.
What's the sheriff have that's compatible with that?
STARCOM 21 is utilized by all public safety entities.
So they all could,
Yes.
911.
911, EMA. I have one for EMA that I need to actually get maintained. But yeah, fire departments, law enforcement, they all have access to them. I'm not sure if the sheriff or ICOM have those radios, but they could get those radios if they wanted to. It's not always deemed necessary, but that's for them. We have a stockpile of basic medications and personal protective equipment that we maintain. We recently acquired a bunch of rain suits and safety vests. It may occur that if we are deployed to a public health disaster, might be rain, we just want to stay dry. We have a variety of tablets for mobile documentation. If we need to do field work on tracking down how an outbreak started in town, these tablets could be beneficial. Instead of writing 1,002 forms, just have a tablet, go door to door while investigating. We are about to acquire an inverter generator, which is going to probably be put in the mobile POD or point of dispensing supply trailer. This trailer is technically not our asset. It technically belongs to the Champaign Region Healthcare Coalition. During this last year, I asked the coalition for this trailer for this purpose because I thought it would be a valuable asset for us. And they agreed. We matched 10%, and they provided the trailer, which they already had, and a couple other supplies that they already had, being tables and chairs. And that trailer is currently sitting in the shed behind the jailhouse because I'm working on the contents, building it so it's ready to be deployed. And afterwards, it will be deployable to the Champaign region. But it'll stay here, and we could exercise with it and use it if we need to. But it is meant to be a supply trailer for a point of dispensing, that is, if we need to go somewhere and mass medicate a population. So I'm really excited about that, and once I get that going, I will be happy. We have an ArcGIS license. Some of you may know ArcGIS is a sophisticated mapping and statistical analysis software. Planetonia has started using that, and it's been wonderful. We have a license, and I've attended one training session on how to use it. I'm going to attend another, and with that, we'll be able to do some geographical statistical analysis on what outbreaks could happen or where we see trends moving throughout the county with outbreaks or with contaminated wells, radon, so on and so forth. So that is an asset that I'm happy about. But most importantly, we have 16 staff members from a variety of backgrounds. I say most importantly because we emphasize our staff at the health department. We have all the tricks and tools in our bags, but without the proper people to utilize them, then we are nothing. So now we have our communicable disease department and nursing department, and they bring wonderful, valuable information and experience. And then there's different varieties within themselves there. We have school nurses that see a lot of what children deal with. We have people who stay in the office, deal a lot with vaccinations. Then we have a Department of Aging, and that's something that I really rely on to help with that specific susceptible population. We have an increasing age population throughout the country, and so we need to make sure that we service those people. And then also environmental staff. They bring an entirely new perspective to what it means to emergency preparedness when it comes to wells and sanitation, mass care with feeding people, and any questions about our assets? Okay. Moving on to what I have currently planned for the coming grant fiscal year, starting July 1st, 2017. I'm going to collaborate more with local healthcare agencies and conduct a tabletop exercise. There's a new rule, emergency preparedness rule. It doesn't necessarily apply to us because we already abide by all the mandates they've created, but it is going to start applying to nursing homes and other different types of healthcare entities. Yep. And they're going to have to do an annual exercise, in addition to have a number of other emergency plans. And this is an opportunity for us to collaboratively work with them, share our resources, and make sure that we are all working towards the same goal of maintaining good health for Iroquois County residents. So, in collaboration with my other EMA half, I'm planning on conducting a tabletop exercise with these entities if they choose to participate. That way I can help them fulfill this year's mandated goal of having exercise by November, but also it increases our collaboration with them. So that's a new project that I'm looking forward to. Continue building our intercooperative networks regionally with the Champaign Region Healthcare Coalition and locally. With the Regional Healthcare Coalition, like I mentioned earlier, our grant is now starting to mandate more involvement with them. I've been pretty involved so far, but I imagine my participation is going to have to increase in the coming year. And locally, the more we know about what's going on locally with other healthcare entities, such as immediate care clinics and so on and so forth, the better we all are communicating and being able to respond collectively. Maintain notification communication drills and the sharing of contact information regionally, stuff I have to do every year, and we do a pretty good job at it, but I need to make sure that we continue that capability. Becoming more affluent with new information sharing platforms. Something that frustrates me is the state of Illinois makes me utilize too many different information sharing platforms over the web. And it's kind of frustrating, but we need to do that to make sure that we are working collaboratively throughout the state, and there's a couple new ones this year. So I'm going to have to get myself trained, or in the case of one or two other network software, get somebody else in the health department trained on them, so we are making sure we're utilizing those to their full capacity. Another large project that I've been working on is I'm going to complete an overhaul of the Public Health Department Emergency Operations Plan to incorporate all hazards, and then complete an MCM ORR site visit, which is scheduled for this coming year. Traditionally in the past, we've had a great plan for a strategic national stockpile response. But what that does not incorporate everything that the health department is going to have to respond to when it comes to public health emergencies. So I'm expanding our plan, so that way we can better be prepared on paper on how to deal with those situations. And that's pretty much completes everything I wanted to talk to you about emergency preparedness. I'd like to entertain any questions.
I have one.
Yes, ma'am.
Does the health department consider the overdosing of drugs as an emergency in this county?
Yes.
Do you have a plan for that?
I do not have a plan, but I know that my coworkers in the health department have been working on that. I will say that our administrator signed a bunch of us up, and we went and actually got trained on how to use Narcan. And we trained the trainer course, actually, so now we are able to train others on how to use Narcan or Naxalone, which is the immediate response drug to get somebody, to save somebody from an opioid overdose. So, in short, yes, I am part of that project, health department. I am not the main part.
Any other questions?
No, but you're a busy person.
You know, that's why I love coffee so much. All right, well, folks.
Good report.
That was very informative.
Thank you.
Thank you.
Yes.
No problem. If you ever have any other questions, there or somewhere else, but you can probably get my phone number. So just give me a call.
Thank you.
Thank you.
Is there any old business to come before the committee? Any new business? We need to move the meeting. Somebody want to make a motion? 9:30 on the 5th.
Second.
And second. This is awful. All in favor to move the meeting? Say aye.
Aye.
Opposed, same sign. Motion carries. And then we'll do the health, the county board meeting. Or, I mean, IT. Is there any new business to come before the, or that was the new business? Is there any other new business to come before the committee?
I move to adjourn.
Been moved to adjourn, is there a second? Seconded by Mr. Bursley. All in favor to adjourn, say aye.
Aye.
Opposed, same sign. Meeting is adjourned.